Marie.
Okay, you could go ahead and come finished.
Okay.
Okay. Okay, I apologize for that, and I'm going ahead and handing it over to Shannon to start the presentation on community clinical linkages.
Okay, sorry everyone. Okay, so today is just a webinar about the introduction to community clinical linkages. So just a short presentation on kind of what community clinical linkages are, how they're used, and how you can start thinking about possibly implementing a community clinical linkage within your community. So to begin with, there are a lot of different ways to define a community clinical linkage, but this is the one that I'm going to refer to during this presentation, which community clinical linkages are connections between community organizations and clinical entities to improve the accessibility of resources to those with or at high risk of chronic disease and to prevent, delay, or manage their conditions. So this definition kind of leaves some flexibility for interventions to be applied to all public health areas and focus on the unique contribution that each sector brings to improving populations. Developing strong community clinical linkages allows healthcare providers, community organizations, and public health agencies to collectively improve access to chronic care services. So a quick overview, I will just explain what community clinical linkages can provide, who they benefit, who participates, how are they used, and then kind of some key factors for a successful community clinical linkage. So the biggest opportunity that a community clinical linkage provides is changing unhealthy behavior in a community. But a few of the other important opportunities that they can provide is they include interventions such as clinical referral, community delivery, and in some cases third-party payment for effective programs. They provide clinicians various options to provide patients resources that they themselves cannot provide. They provide community programs, guidance, and connecting clients with their services. And they provide a better resource for patients to actually follow the doctor's orders and take charge of their own health. So the clinical aspect of a linkage is like an organized healthcare. So this provides an informed and an activated patient, which then can go to the community aspect, which is the resources and the policies, and provides a prepared, proactive practice team to help this patient. Building these linkages between the community and the clinical sector is critical for improving health outcomes of participants in a health program, as well as improving the program's sustainability. So, for example, a health clinic might partner with its local public health agency to develop a referral system for screening for type 2 diabetes patients, or a clinic might partner with its local YMCA or some other gym, and they might offer discounted memberships for diabetes patients. In either scenario, the patient goes to the doctor, they're diagnosed with type 2 diabetes, and they aren't just sent home to deal with the consequences and the planning of a lifestyle change on their own. They're provided with a community resource and a proactive team that's ready to help them make their lifestyle change more accessible and more accurate. So benefits, patients benefit from these linkages because it increases their access to medical care and comprehensive services. The clients of a community organization who lack regular primary care can be evaluated and treated by clinicians for acute and chronic conditions. And patients of primary care practices benefit from referrals to community organizations, which tend to focus on social determinants of health, such as housing, employment, or food needs. So collaborations between clinical, community, and public health organizations offer a win-win scenario for all of the participating members. So in addition to increasing the availability of preventative services of the community at large, collaborative efforts between primary care practices and community resources offers the possibility of an effective, efficient, patient-centered approach to address the preventative service needed. Even though these resources may be available, clinicians may not be aware of them, or they may lack the ability to make a referral to these external organizations and then receive confirmation back that the appropriate preventative services have been delivered. So making these linkages and collaboration between the two are really important. Clinical care delivery systems play a critical role by helping patients address their unhealthy behaviors, such as tobacco use, overweight, unhealthy diet, physical inactivity. And then the community services provide specific recommendations for the delivery of clinical preventative services, such as a smoking cessation quit line, a chronic disease self-management program, screenings, behavioral counseling, referral change programs, just to list a few. So some of the stakeholders that can be involved on the community side would be local health departments, community hospitals, YMCAs, senior centers, employers, and businesses. And then on the clinical side would be physicians, nurses, pharmacists, behavioral counselors, public housing, as some examples. And linkages can range from networking, which is simply exchanging information and referrals, to merging, where two entities have a balanced role and culture and operate as one entity. Creating sustainability, effective linkages between the clinical and community settings can improve patients' access to preventative and chronic care services by developing partnerships between organizations that share a common goal of improving health of the people and the community in which they live in. So like I mentioned before in this presentation, the main goal of a community clinical linkage is to improve overall community health. But in order to reach that big main goal, you have to set a few smaller goals. So some goals to aim for of a community clinical linkage would be coordinating healthcare delivery, public health, and community-based activities to promote healthy behavior. Forming partnerships and relationships among clinical, community, and public health organizations to fill gaps that are needed. Promoting patient, family, and community involvement in strategic planning and improvement activities. And on this slide, I just kind of highlighted an example of community clinical linkage framework from the Agency for Healthcare Research and Quality. And in the framework, the short-term process that is circled represents several linkages that link community interventions and innovations to improved outcomes. So short-term goal would be increased awareness of community resources, increased communication across sectors, improved referral and tracking mechanisms, which then leads to improved coordination of services for individuals, which then in the long term leads to improved health behaviors and eventually improved health outcomes. So I put this example as a community clinical linkage. This is the Navajo Nation's Fruit and Vegetable Prescription Program, which some of you may have heard of. They adopted this program, which was created by Wholesome Wave. Excuse me, the Fruit and Vegetable Prescription Program helps healthcare providers give families prescriptions that can be spent on fruit and veggies at local grocery stores. So their goal was to prevent obesity. 1 in 3 people are overweight or obese. Annual medical costs for obesity in the United States are $145 billion. So this was a preventative program. And this is kind of the cycle of how the fruit and veggie process works. So a patient goes to the doctor and the doctor enrolls them into this program. They are then sent to attend a clinic, which then they set goals and discuss nutrition and the importance of eating healthy. After setting their goals, participants receive a fruit and veggie prescription during the visit, which they can then take their prescription to the farmers markets, the local grocery stores, and they can use these prescriptions to buy fresh fruit and veggies with participating grocery stores. So the grocery stores take these prescriptions, and then in which case the program reimburses them for these prescriptions. After the patient goes and buys fresh fruit and veggies, then they go back to the doctor, they're prescribed more prescriptions, and they can just continue the cycle of having access to fresh fruit and veggies. So the clinical factor of the fruit and veggie prescription program is the healthcare providers suggest and enroll eligible patients to the program, and they prescribe them vouchers. The community factor is the local grocery stores participating, and they stock their fruits and veggies and accept the vouchers as a form of payment, which provides easy access to a healthier diet for program members, lowering the amount of community members at risk of obesity and diabetes. The patient benefits: they are able to carry out the doctor's orders for healthier eating habits through shopping at their local grocery stores and refilling their prescriptions once a month, making it as easy as possible for the patients to be able to make a lifestyle change. Another example I used was the Better Choices, Better Health program, which is a community-led evidence-based program modeled after Stanford University's chronic disease self-management program. Better Choices, Better Health is designed to help people gain self-confidence in their ability to manage their symptoms related to chronic conditions. This is a chronic disease self-management program designed to help people get back in charge of their life with a supportive environment and a sense of community to help people through their daily activities while dealing with emotions that come from battling a chronic condition, and learn to better manage those conditions in their life. So the clinical factor of the Better Choices, Better Health program would potentially be a referral system. A patient would go to the doctor and be diagnosed with a chronic disease of some sort, and they would be referred to this Better Choices, Better Health program. The community factor is the lay leaders of the Better Choices, Better Health program teaches community members with chronic conditions to manage those conditions and related emotions on their own so that they don't have to take as many visits to the doctor. And then the patient benefits by being able to learn important self-confidence and managing abilities to their chronic condition systems, and in return also saves them money by learning how to manage their own symptoms. So the next steps, it may seem obvious to link organizations that share similar goals for groups of patients. However, clinical and community groups often provide services with little interaction with each other. So to build and improve linkages across private and public health organizations within communities, it's important to first identify your potential team members, so your providers and your outreach, and then to identify the critical gaps within your service unit, and to fill those gaps by using strengths and abilities of the participating organizations. So work with existing partner clinics and community-based stakeholders to identify referral resources through general assessment process. For example, clinic assessment, provider surveys, provider focus groups, participant surveys, also obtaining feedback from providers on their current referral process and needs. This step can help identify opportunities for process improvement within provider sites and can inform the development of a referral directory. And then help create linkages between providers and community resources, such as the community health worker. Community health workers can visit patients at their homes, assess their health, and link them with clinics and hospitals. So community health workers are like the frontline public health workers, and their relationship with the community allows them to serve as a liaison or a link between health and social services and the community. And then help develop systems to inform patients about the benefits of preventative services and focus on patient engagement and improved patient outcomes. Are just some steps you can think about taking to possibly implement a community clinical linkage within your community. these are some really good sources that I used for this webinar. So if you want to check those out, they have some really good information on what community clinical linkages are and some of the steps you can take. So are there any questions or anything Marie or Nicole would like to add?
No. Can you hear me?
Yes.
Okay. No, I don't have anything to add other than we do have a program that is currently working on community clinical linkages and has had quite a bit of success in their community. And so one day we might ask them to come present to other good health and wellness tribal partners, as well as other partners who are on our webinar, and talk about some of the great things that they do in the future. So that's something we can look forward to, as well as the Better Choices, Better Health program that we do offer. We do offer lay leader training. So if that's something that is of interest to any of the programs that you all are a part of, if that's something you can see working in your community, or even if you want to just know more about that program, we do have a program coordinator here who does provide those trainings and does have money to provide those trainings in your community. We'll also be hosting a lay leader training coming up shortly, more than likely here in Rapid City. And so once we get that information, we'll be getting that out to tribal partners. So if we don't already have your contact information, then please let us know and we can send that information to you.
Thank you, Shannon and Nicole. I think that Shannon did a really good job of explaining how organizations can connect with clinical organizations and just help provide more services to the community as a whole. I would like to thank everybody for coming. Are there any questions that anybody has?
This is Tinka. It looks like you have a couple questions in your chat box.
How long has the fruit and veggie prescription been happening? I am not sure how long it's been going on, but the Wholesome Wave is the program that designed the fruit and veggie prescription program, and they have an entire website if you just Google Wholesome Wave, and they have a lot of videos on it too on YouTube that are really resourceful that I thought. And I'm sure that would tell you how long they've been doing that, because I'm not really sure.
And we were actually on, and COPE is the Partnerships for Healthy America, and COPE, I think that's what they're called, but they are the ones who have been kind of implementing this program in the Navajo Nation. And I remember being on one of the webinars, and I feel like they had been doing it fairly new, but I think at that time it was in their second or third year. So, but like Shannon said, that resource is available, and they did have a lot of success. If we do have interest, it could be a possibility that we have another community clinical linkage webinar. This was just sort of meant to be an introduction to the concept, and then we're planning on having other webinars specifically for community clinical linkages with programs such as COPE or Better Choices, Better Health, and our tribal partner who is also working on these, so that you can see real life examples of community clinical linkages happening and working in tribal communities. And so that's something that we're looking forward to working on coming up. So.
Thank you, Nicole and Shannon. Are there any further questions or comments that anybody has about community clinical linkages?
There's one here. What type of training would you recommend or provide to the community health worker to assess the community? Nicole, do you have any recommendations for that?
Yeah, depending on what type of assessment you're looking at, we actually have a really good one that one of our cancer programs worked with our PSC task force to modify the CDC's change tool. And so it has been modified to fit tribal communities, and it's called the PSC tool, Policy System and Environmental Tool. So it's a shortened version, which also includes what we do is it's more relevant to tribal communities. So instead of having 8 steps, it's been knocked down to 4, and so it's a really good assessment tool for community. And we actually can provide that training to her if you'd like, Nettie. So if you want to let us know how soon, we would definitely be able to provide an overview of that tool for her. There are other tools out there, and we can definitely look for training opportunities. So depending on what type of assessment you're looking to do, then we could potentially do training for Ashley on that if you'd like.
Thank you, Nicole. And Nettie, I know that as part of the Good Health and Wellness program, if requested, we will come and help you with develop any of those assessments as needed. It looks like we have another question. Who pays for the fruit and veggie FRX plan? How do you ensure that the person buys fruits and vegetables?
If this is a program, if the fruit and vegetable program is something that you have interest in, I think we can talk with COPE. In fact, they were just in Partnerships for America. They were just here. Was it last week, Marie, or 2 weeks ago? They stopped in while they were on their way to Rosebud, and so I think that we can arrange a possible meeting with them or training with them. To talk about getting the fruit and vegetable prescription plan in your community, or how that would look. So that's something that Marie could definitely work on for you, if that's something, or if there is enough interest, that's something that we can work with them to provide a training on in the future, where we can have more tribal partners, and whether it's Pitch or anyone else who's interested in setting something like that up.
Thank you, Nicole, and thank you everybody for all the questions. Are there any further questions that somebody may have forgotten? Okay, well, I would like to thank everybody for participating. I will be sending out a follow-up to this presentation that will have not only the slides from the community clinical linkages, but also an evaluation of the presentation where comments could be provided, as well as feedback to let us know what we're doing right and where we can improve. If anybody has any further questions, feel free to contact me, Marie Zephyr, at marie.zephyr@gptchb.org. And I will look forward to, please watch for future webinar series, as this is a occurring it's an occurring event that we have every other month. And I would like to thank you again for your participation, and have a good day.
Happy holidays.
Thank you.